My name is Isaac, I'm part of Team SMARTFLO, and today we're going to talk about death. Well, we're going to start talking about death, but hopefully avoidance of death. So we're going to start talking about TB, so tuberculosis. Now, a lot of people don't realize that this affects 1 in 4 of all people globally. And that's 10 million new cases every year and 1.2 million people, despite the fact that we have treatment for TB, dying every single year. So this disproportionately affects low socioeconomic communities, and the current diagnostic test costs around about $250 USD. And so this is why it significantly impacts lower socioeconomic areas, when the basic wage per day could even potentially be as little as $1 or $2. So $250 USD means that they can never afford this kind of treatment. So there's also difficulties diagnosing the conditions due to lack of actual current treatments available. So what's the current situation? Well, the current situation is we use strip tests. So these give an intensity value. So the color on the test indicates how infected a person is. And the benefit of strip tests is that they're cheap and easy to use, but they have problems with accuracy. And that's what Ameh came to the MedHack to try and solve. So what we tried to come up with was an algorithm or a data-driven machine learning approach to use a smartphone image to quantify that line on those strip tests. So that in lower socioeconomic communities where we can use cheaper strip tests, we can basically come up with a diagnostic for the person who is being tested. And we tried to use the intensity of light to determine the concentration value. Now, unfortunately, we didn't actually get it working until 1 minute before the deadline. So we have all of the bits in place, but we don't have a working demonstration for you all, but I'm sure we can get later on, we can have a talk about the tech later on. And basically the takeaways are the impacts or the potential implications for this technology. So we started with TB, but in reality, this isn't just applicable to TB. This is applicable to any strip diagnostic test that uses this same method. So this could be, think a pregnancy test, or it could be for malaria, or any other test or any other conditions that use this test as their primary source of diagnostic, especially in lower socioeconomic communities. So hopefully we can integrate it with hundreds of other tests that are already out there, and hopefully use this as a platform to develop future diagnostic tests in the future. And this is the SMARTFLO team. So thanks for the enormous amount of work we've had. And that's